Hey everybody, welcome to Who Let the Dogs Out. Today we've got a special interview for you that I'm very excited about, so stick with us and enjoy the show.
Who let the dogs out? Who let the dogs out?
Welcome to Who Let the Dogs Out, the podcast designed to help you enjoy life with your best friend without all the frustrations. Join us each week as we help families across the country do just that. I'm your host, Corey, and I'm joined by my co-host,
Sally.
And we're joined by a guest, Dr. Melanie. Welcome to the show.
Thank you so much.
Yeah,
I'm glad to be here.
Yeah, me too. I'm so excited about this because we've been talking about this for a while, and life's been crazy for all of us. And so, anyways, we're finally got it. It's finally working out. So this is great. Well, you know, we had on Dr. Sally a couple weeks ago, and I was saying whenever we introed that was special to me and Sally because, you know, she had put down both of our dogs and helped lay both of them to rest. But you were very crucial in keeping Mia happy and healthy while she was still here or whatnot. And so anyways, this is very special to me too, just because you were such a crucial part of that and her long-term care as she got older and stuff like that. So anyways, thank you for everything you did for us. That was just so sweet.
Thanks for trusting us with her care. She was wonderful to work with, and I'm glad we could be part of that journey. You know, it's always hard, no matter what part of the journey you encounter somebody, you know, with Dr. Sally at the end or with me. You know, we had a long road with her, but we did some good things and got you some special time with her.
For sure.
That's great.
Well, guys, if you're new to the show, thank you for watching. If you are, we ask that you click the subscribe button just that way you can get, you know, new shows. If you get any value out of today's show, I know you're going to learn a lot. I know I'm going to learn a lot because this was completely new to me, and I don't even think most people know about this. So you're definitely going to learn something. So if you learn something, if you don't mind, share the show with a friend, family member, colleague, something like that, just so that way we can get the message out. Because I think this is a service that people need, and I don't think enough people know about it, honestly.
Yeah.
All really just like the special care that you can do for dogs, you know, acupuncture, chiropractic, the laser stuff. I mean, there's so much to it. So anyways, well, let me do this. Let me do the intro that we had made real quick. So just to give everybody a little bit more info about you. So Dr. Melanie, she is Collierville native. You lived on the same farm your whole life. I didn't know that till today. She always knew that she wanted to be a vet, which you can tell whenever you work with her because she's very vet-like in the best way possible. She went to University of Memphis for undergrad, and then you went to Mississippi State to get your DVM, right? That's what it's called, Doctor of Veterinary Medicine. You went to acupuncture school, and I think you said that place is called Chi, right?
Chi University in Reddick, Florida.
Okay. Did you have to actually go there, or was it like online
It
class,
was hybrid. We attended 2 on-site sessions, and then we had internships to follow up with, which I did really extensive internships just to kind of grasp different practices because this was such foreign territory to me. I've been practicing for 10 years in general practice, and this was a very different setup, and then starting a business all in one. So it was a lot to grasp initially and structure the practice the way I wanted.
Yeah, I could see how that'd be a lot because honestly, till you just said it, I completely forgot that you did general practice for a long time. But you founded Horse and Hound in August of 2023. And then you've done a bunch of stuff since. You are in chiropractic school, doggy chiropractic school, and horse chiropractic, I suppose.
Yes.
And then you mentioned something else about horses, but it went a little over my head. So if you want to say what that is too.
Yeah, so I'm also enrolled in an equine performance medicine course through Chi University. So essentially just we discussed, you know, growing the equine side of the practice a little bit more locally. We do a lot in the Nashville area, and we have a great facility to house patients and offer a little bit more service. You know, some of these patients need rehabilitation. They need daily work, not just the acupuncture every week or every couple weeks or every month or whatever that patient might need, what their indication would be. But having something where we can really support patients, because there's, other than the Jekyll Center near Nashville, there's really not a whole lot around here that's offering that. So we kind of try to.
That's the horse side.
That's the horse side, and you know, there's a lot on the dog side we're offering that people, you know, locally have not offered, and so we've just essentially evolved our practice to give the people what they want because we've learned that there's a lot of things missing in our community that are needed for these pets and
for sure.
performance horses.
Yeah, I mean, especially like you said on kind of the specialty service side or whatnot.
Absolutely.
There's definitely, because it's a very niche, like providing, and I don't know if it was like on Dr. Sally's episode or if it was a different episode, but it might have been a Dave Ramsey episode for all that matter. But basically, like after you go to vet school, similar to like how human doctors do it, you can get a residency and kind of like learn what you want to specialize in and stuff like that or whatnot. And so then vets after school will pick like outside of general practice, I suppose, they'll pick like a specialty or whatnot. And it seems like you've kind of picked a few, you know, horses, dogs, chiropractic, acupuncture, the whole thing. So anyways.
Yeah, so essentially and I did get a chance to listen to a good portion of Dr. Sally's podcast that you sent me last night, which was very interesting. She's great and offers a great service to our area and really helps me. We complement each other, so I'm so thankful for her. But I did hear where she touched on, of course, you can do internship residency. You can specialize in surgery, internal medicine, dentistry, those type of things. And I did have a passion for surgery, small animal surgery, when I was in school, and I
You mean like dogs or even smaller animals?
just dogs and cats. Okay. So that was an interest of mine. But then I ended up choosing small animal general practice initially out of school just because the internship and residency.
Just to clarify, by small animal, do you mean like quite literally like just anything smaller than a horse, basically? Like dogs, cats, stuff like that?
Small animal kind of fits into that category of dog and cat. Now, some small animal practices will also incorporate some exotics, as we would say, which, could include your gerbils, hamsters, snakes, birds, things like that. But small animal generally is going to refer to dogs and cats primarily as a practice.
Yeah, that's new for me. And I didn't mean to interrupt, but I wanted to clarify.
Oh yeah, no, of course. I think that ultimately I started out wanting to do equine medicine, but having a family doing that is really challenging.
You're on call.
It's your phone rings at 3 a.m. How do you do that when you have small children? And people do, but it's hard. And it's very hard to get out of debt as a equine practitioner. So I ended up choosing small animal surgery after that while I was in school. My plan changed, but then, having to move away for internship residency. And then you're in this small niche of job opportunities too. So there's not as many options. So with small animal general practice, lots of options. You don't feel so, you can live wherever. There's job opportunities. So at the time that seemed right.
There's need for vets everywhere, basically.
Especially small animal veterinarians. There's a major shortage and lots of opportunity. Yeah. So I could come back home and find a job very easily. So it just suited me at that time.
No, that makes sense. So you said you did general practice for like 10 years before getting into like the acupuncture side of things.
Yeah,
right?
well, I guess I've been a vet for 10 years, but and then prior to starting my business in 2023, I was strictly small animal general practice.
And you did some stints at the emergency hospital too.
Yeah, I've done some. There's
whatever.
Been some emergency work here and there, and just relief work. Just like Dr. Sally mentioned, she did relief. We actually crossed paths many years ago in a relief setting, and so that's a great. If you're transitioning between jobs, not sure what your next step is, it's a great thing. You fill in at different hospitals, figure out what you really want. Or like when I started my practice, it was great. I could supplement my income as much as I needed. The opportunity's there, but it's not. You're not forced to.
No, that makes sense.
So you can grow. Yeah.
Wow. Well, thank you for all that. Okay. Well, I wanted to do a lightning round and then we'll talk about acupuncture and just talk about everything you do because it's super, super fascinating to me as somebody who didn't know anything about it and still kind of don't, but liked it. So what's your favorite breed of dog?
So that would be a Labrador Retriever.
Not the Frenchie?
No, I love her, but they're different. A lab is going to listen a little better, as you probably know as a dog trainer. They are more eager to please. So I like that in a dog.
Okay. What's a breed of dog that you would not want to own?
So there probably are a few, but I would think the first one I would go to would be an English Bulldog, just considering the array of health issues they have and the kind of special needs. They overheat easily and things like that. It's just, even as a vet, I feel like I would be spending a lot on the medical side of things to maintain that
even
patient
if you
or
were
that
doing
dog.
all of it.
Yeah. Oh, yeah. Absolutely. They just
cost.
out the gate, they almost just need surgery immediately just to
with
anatomically
the
correct
flat nose
things.
and stuff like that.
Yeah, the elongated soft palate, the stenotic nares. Sometimes they have entropy on their eyelids roll in, and those are just things out the gate that you need to correct. So it's a lot. Some come out better than others, but be prepared for issues.
You were saying a few. Are there any others on the list that you
feel like? I mean, we could talk all day about it, but I mean, some of them get like what you would call a corkscrew tail, where their tail is kind of twisted into their sacrum per se. So they have this pocket, this fold, and so sometimes you have to go in and remove part of the tails because they're getting chronic infections. They get skin fold infections on their face. They're just predisposed to atopy and skin conditions.
Is that the same breed or is that a different breed?
This is all English Bulldogs. Now, French Bulldogs, similar issues, but on a lower scale generally,
Right.
less likely to have as severe of these issues
Yeah.
in most cases. So a little bit better version, I would say, if you're really into the bulldog.
Yeah.
I would vote. And I went to Mississippi State. That's our mascot, and he was amazing.
I didn't even think about that. I didn't put two and two together.
And he was very well maintained and good breeding lines.
Yeah.
You know,
They are expensive dogs, though.
Genetics play a role,
definitely
absolutely.
do.
So
Yeah.
that's another thing.
Okay, most common condition you treat. I'm sure we'll get into that more later. So the quick version.
Yeah, I mean, I would say in dogs, like the two most common are going to be arthritis and intervertebral disc disease. So like just
For the rookies, what does that mean?
So intervertebral disc disease is essentially like a disc compression, like ruptured disc per se, and more,
So like something in the spine, like a problem in the spine.
compressing the spinal cord, causing deficits to where the dog may be paralyzed, may have delays in proprioception where they can't really flip their feet. Like Mia ended up having that at the end. So issues like that, neurologic issues respond really well to acupuncture, and then just your chronic old arthritic dogs, those are probably our most two common.
Gotcha. Okay, best/weirdest dog name you've gotten.
So there's one dog that I saw recently that comes to mind that I just thought this was the cutest thing. Her name was Gravy Train, and I loved that. she was
Me
precious.
and Sally have not gotten that.
No, we've not got.
You've never had a gravy train?
No,
No, we haven't.
no.
I thought that name was precious.
Okay, and then small or big dogs, which one's more dramatic?
Generally, it's going to be small, as you probably would agree. I would. I mean, some big dogs are extremely dramatic, but as a stereotype, I would say small.
You know who wasn't dramatic? Mia. She was not dramatic. She
No.
would just let you pop those needles in her, which
She
I was
was
not. I
so
did not
well.
know what to expect whenever it came to that. So
She was a good patient.
she was. Okay, so what made you want to be a vet? You sound like you knew that your whole life, but what made you actually want
did.
to be a vet?
Yeah, so I grew up on a farm, and we had many over 50 stalls on this farm. So we had trainers of almost every discipline in and out of our farm over the years. And we had a breeding stallion that, we did a lot of reproduction. So I just grew up around baby foals and breeding horses, and the vet was out almost every day, with these trainers out there. There were always things going on. So after school, I would just hang out and watch and learn. Wow. And so that really is what piqued my interest to become a vet. And again, it was always equine medicine until I got into vet school, but that was always my passion. And we always just had dogs, and I mean, every animal, we just were an animal loving family. So it just came naturally.
Sounds like heaven, honestly.
Yeah.
I mean, I want to get land and just buy a
Yeah,
bunch of
you
animals.
do.
That's
You
that's my
should.
dream. That's why I'm
I
working so
encourage
hard.
you
So
to do it.
yeah, chickens, goats, maybe a horse, maybe a cow. I don't know.
Yeah.
All the stuff, plus a bunch of dogs.
Absolutely.
So, a couple farm cats, who knows?
Yeah.
Anyways, so I guess the follow up there, and I guess kind of jumping into acupuncture stuff, is to like, you became a vet, then you did general practice, surgery, emergency, kind of, delved into all the, I guess, like maybe like normal vet work or whatnot, I suppose. And then you specialized in acupuncture. What made you want to do that? And then I guess the follow up there is like, what kind of certification is required / training is required for that?
Yeah, good question. So there's actually no, the only, I guess, legally training that you have to do acupuncture on animals. The human side is a little bit different, but for animals, it's just to be a licensed veterinarian.
Okay.
That's all you need.
So any vet could basically become an acupuncturist, hypothetically.
Yeah, and they don't actually have to do the course like I did through Chi University, but they wouldn't know what they're doing.
Right.
Now, there are some vets that, I always encourage people to utilize acupuncture even if they're not super familiar with it. So I do feel like there's some points, like a nausea point, that can work really well in general practice. So I've taught some practitioners, some just basic points.
Yeah.
Now, it's not a comprehensive treatment. It's not quite the same, but you can utilize a point here and there and really help a patient. So I think it's great that all vets are able to do it. But I think if you really are going to offer acupuncture as a service,
know
you
what you're
need that
doing.
training. You need that training to actually, it is a lot that goes into it, a lot of studying. And I will say, even after doing the course, extra internship hours, lots of studying, and strictly focusing on that in my practice and not really doing general practice anymore, I still have a lot I can learn.
Yeah.
There's still the list goes on. You could learn forever. Just like general
imagine.
practice
Yeah,
or dog training.
Yeah, I was
know?
about to say, I mean, 10 years in, I've still learned. I literally just learned like this like magical trick last week, and I've just been telling everybody about it, you
Yeah.
know? And so I imagine too with like how specific like dog bodies are or horse bodies, and like just how many points there probably are and stuff. And I could only imagine like how much there is to learn to that. But going back, so what made you like, how did your eyes open to that? What made you want to do that initially after all those years of like general practice and stuff?
It's actually kind of a funny story because, you know, and I get clients that are referred to me. They're desperate. Their dog can't walk. And they're sent to me. They don't believe in it. They're like, I'm here. You know, I don't know what else to do at this point. And you can tell they're not
in full
a believer.
transparency. That's how I ended up at your office too.
Yeah.
I was like, I'm literally willing to do whatever it is to fix the dog.
Yes,
you know,
whether I
so-
believe in this or not, I was sent here or I found this. I'm going to try it at this point. I'm desperate. So I do get a lot of people like that, or I get the full believers that know so much already. But I was the type that didn't believe until shortly before I started my practice.
Yeah.
Actually, I wasn't referring patients for acupuncture. I did not learn about it in school. It was not something that came up at Mississippi State. Now they do have an acupuncturist down there, from my understanding, and there's more school, especially out west. It's more progressive out there, but there are more schools even in the South that are offering more acupuncture and educating those students on that. So that I love that. I think that's great. I think we have a long way to go. But my thought was, if I wasn't taught this in vet school, then it's not right. I'm very scientific, and I just didn't understand why they wouldn't teach that to us if it really had value. So I thought it was voodoo, but I was pregnant, and this is how it comes into play. So I was very resistant. I was desperate. I was pregnant, in a lot of pain. Had been seeing a chiropractor that was helping me, but that was not enough. My technician at the time in general practice said, you know, she kept saying, get acupuncture. You're miserable. You have to do something. And I just kind of kept blowing it off. And then finally one day she said, what, are you scared? I mean, I know it's not the money, because you've spent money on spinal injections, which you can't get now. But you're obviously desperate. So what is it? You must be scared. And I was like, all right, that's it. I'm doing this. Like, it's not that. I just didn't, you know, I didn't believe in it. So I see this doctor in Midtown. She was great. And I felt a lot better after the first treatment. But then I didn't want to go back to Midtown. So I started doing some research, look up a local acupuncturist in Collierville, it's the same woman. I had no idea. And I was like, I think you're great. I'm not looking for somebody else for that reason. I don't want to drive to Midtown. This is perfect. It was fate. So then I see her again.
Were you at your farm then? Because that is kind of a haul from Olive Branch area, Collierville area.
I was working in East Memphis, but really I was living out in Collierville. So I had to do it on 12-hour days in general practice. I had to do it on a day off. So so anyway, start seeing her in Collierville. She helps me so much. And then I get interested, and I want to read about it. I want to understand it. So I start immersing myself in it. I'm a loyal client to her, and it just built from there. And then I thought, you know, this is something that that is needed more in this area. And I'm so interested. I want to learn about it. I might as well learn about it in the right way and enroll in a course. And I just always had that urge to work on horses. That never went away. So this gave me that. It gave me the opportunity to be a business owner, which I always wanted, and the opportunity to not work less, but work shorter hours, so I could drop my kids off and pick them up from school. So it really kind of checked all the boxes.
I was about to say, a lot of birds, one stone.
Yeah, it just felt, it was never something I anticipated, but it's turned out to be greater than I ever expected. Yeah.
That's so cool. So kind of recapping. So you're in a ton of pain, you're pregnant, and you're like, fine, I'll try it. So you try it. It helps you a ton. And you're like, man, we got to do this for animals, basically.
Yeah. And there's a couple of practitioners that do it here, but their practices are maybe structured a little different. They're offering some general practice or other services.
I was going to say, the one that I know that does it, you know, she's like a regular vet. I'm not trying to say that disparaging. It does like normal vet work, and then that's like something she offers at the clinic as a side service.
Exactly, and that's great because some of my clients really wish I did more. So I mean, there's pros and cons to each scenario. So for me, I wanted to really fully immerse myself in it, and I felt like if I'm doing this in general practice, and then the hit by car comes in, for me, I get distracted, and I feel like with acupuncture, you know, you've been there. The dog has to be calm. You have to be calm. You know how it is as a dog trainer. They sense your energy, and if, you know, triage and so on. And I just wanted to really dedicate my focus and time, because that animal has to be calm and compliant.
Yeah.
And you, as you know, coming to us, there's a lot of things we do to ensure we have that environment for
Yeah,
that pet.
no, it's definitely very calm and very
and one
relaxing
pet at
over
a
there,
time,
for sure.
so they're not distracted by
for
other
sure.
things going on.
That was honestly something I don't think I'd really considered until we had talked to Dr. Sally, because I was like thinking about it from the point of like a general practice, kind of thing, where it's like, okay, if I'm a vet, I see a brand new family with a puppy and they're over the moon. They're so excited they just got a puppy. And then I see an old dog who maybe has like a little something going on. And then the car wreck comes in, and then I've got to put a dog down, and then I'm back to a puppy. And it's like you have to change for
so
all these
hard.
families over and over and over again. I'm just like, that has got to be a big mental toll, on just, your psyche, as, having to go and like be this new person every time you walk into a room based on the scenario and the vibes of the people and how upset are they, or how happy are they, or are they complaining about their bill? And it's just like so much to manage over, and like,
it's hard.
I could honestly only imagine.
And that's the thing with euthanasia, where I think, no, you don't have to just do acupuncture or just do euthanasia. But for those clients, and I do think the acupuncture patients, in my experience, I did used to do it out of a clinic. There's noises, there's dogs, there's smells, there's, waking up from surgery, crying in the back. So I think I get better compliance for my patients in the setting that we offer. But also, like you said, wearing the different hats, going from one thing to another, being distracted. When you have a euthanasia and then you have a dog recovering from surgery, it's really hard to be as focused as that client and pet deserve.
Yeah.
And we do a great job of it as vets, but that's where I think Dr. Sally is so needed, because she can really offer a very special service that's unique, that a lot of people want, as you both can attest to.
Yeah, I just even meant more from your side, like having to go from like you said, to doing like something crazy with like an emergency situation, and then have to go, okay, now I'm going to be calm, and I've got to pop these needles into the dog and calm down. And it's like cortisol has just been spiking from the crazy. Anyways, like I said, tough. I can see why specialize and having your own place would be like a big deal. Yeah.
Yeah, it's helpful.
Yeah. So whenever you've talked to like other professionals that are in the vet space or whatnot, are they kind of like you, and that like I guess you're networking with other vets where they're like, okay, this is kind of woo-woo, like this isn't real, like, or have you been able to like sell and convince people that this thing does work? Like, what's your experience been like there?
Yeah, I think when I first started, I'm not a sensitive person, so I wasn't, overly sensitive about people and their perspectives on this, because I know it's something that's not widely, known in our region. Out west, everybody does it. Everybody knows about it. But here, it's not. And especially, I've been out of school 10 years. There's a lot of vets older than me that really, really have not been exposed to anything integrative or, any of these newer type of methodologies. So I do, I expect people to not believe, and there are more of the older vets, I would say, but there's a lot of older vets. I've got this guy, he's probably 70, this vet that he was texting me today trying to send me a case. He sends me as much as anybody. So
I was going to say, not Dr. Parker, is it?
No, actually, he's in the Nashville area, but he's very open-minded and up to speed on everything. So, but then there's people like me that just didn't understand it, weren't educated on it, too busy to look into. Focusing on what you do. So, but I do have a lot of people, some vets more than others, that send me a lot of cases. And then there's some that send me a few, and some that I don't see any from. And a lot of people find me organically too. They're like, I was told there's no other option, found this on the internet, said I need acupuncture, found you, came to you, and so on. So a lot of it's organic.
We'll say that is the one probably very nice thing about being the main only practitioner in a business in a space, is because it's like when people Google doggy acupuncture in Memphis or the surrounding area, it's like you're the only one that's popping up, Yeah,
I'm paying less for Google ads than you probably are, I would say.
No, you literally told me, you were like, we spend so much. And you're like, and I was like, how much? I'm like, oh my God, that's so little compared to what we spend every month. I'm like, we're competing for like clicks on dog trainer near me, and it's like doggy acupuncturist.
Yeah, we don't spend much.
Yeah. What a blessing.
It is a
okay.
blessing,
Well,
yes.
I guess actually jumping into acupuncture and talking about maybe some of the science behind it, stuff like that. I guess overall, like, how does it actually work? Like,
yeah, so I could explain it for this whole podcast, but trying to do the quick and dirty, more layman terms of acupuncture. So and some of these the words, the terminology is a little different, but we talk about chi, which is your energy, which it took me a long time to just accept like that word. But I mean, really, when we think about it, energy is everywhere. Everything is energy. Everything we do, everything's based off of energy, and that dates back, to a lot of the old scientists that have been around, forever in physics and so on. So we know everything's energy. Your body's energy. You have to eat to get energy. So your body, if you're these young puppies that I walk past in the hallway, their energy is good, as you know. I mean, there's not a lot wrong with them. They feel good. They're happy. Everything's great. But as you get old, you get certain conditions, certain health conditions or mental conditions or what have you. I mean, there's a lot of things that go wrong. So then there's imbalances in your body. So, for example,
So your chi would be off.
Your chi's off, your chi flow is off. So if you have, I use this example sometimes for my cancer patients. If I have the flu, my body's depleted, so then my back issues are worse. Everything hurts worse that bothered me before because my energy is going to heal me from that virus versus maintaining these other issues. So imbalance could be cancer. It could be like Mia with her ambulatory or walking issues that she had, arthritis, whatever. So we restore kind of the balance. So there's meridians in your body, which are essentially these channels in your body. Acupuncture dates back 4,000 years ago. The ancient Chinese did not know all this when they were doing it. It's amazing that they figured this out without all the there's over 30,000 peer-reviewed studies now indicating the efficacy of what we do, but they didn't have that. They were using stones to insert in acupoints, and but they figured out these points, and a lot progressed over the years.
Is that what a meridian is? Just like a point to actually put a needle into?
It's essentially the channels. There's 12 main meridians that we talk about, and there's channels that are going through the body, and then there's different points on those channels. So we'll access certain points. So there's a point kind of on the shoulder on the bladder meridian that called the influential point for bone, bladder 11. I use that a lot because a lot of these patients have joint issues, bone issue, whatever. So I can help the knee, if you have a knee issue, by putting a needle up here on the shoulder and that point. And we'll usually utilize local points as well. But so there's a lot of points that have specific functions. So we really try to use the least amount of points possible, so we're not, bothering the pet more than we have to. Also, just because it's actually better, you get better results. So if this point does double duty, it helps the knee, and the pet's been nauseous or doesn't have a good appetite, and it can do both things, then I'm going to hit that 1 point versus 2 points somewhere else.
Yeah, that makes sense.
Yeah.
Wow. Okay, so kind of recapping that. So like dogs have chi, so overall just their energy. If something's off because they're sick, they have a disease, cancer, something like that, there's an imbalance. And then the meridians are the channels, and then there's points that are on the channels, the meridians, that you would then plug a needle into that would then kind of cause everything to kind of level out, so to speak, basically.
Yeah, essentially we're irritating a point by sticking a needle in it. Well, there's multiple forms of acupuncture. Most people think of the needles. There's some other forms that we utilize, but
that's
essentially
what you do, though,
irritate.
Right? Needles.
Well, yeah, and then the aqua acupuncture where we're using the B12 and saline to inject points. Electro, where we hook them up to the machine, so we will stimulate down a meridian and actually stimulate an important point more effectively by sending the electrical stimulation through it. So we get a stronger response, can help with mesenchymal stem cell release and so on through that. Pneumoacupuncture will inject air into areas in some cases. Mia wasn't a candidate for that. Laser acupuncture, we stimulate points with lasers. And acupressure, where you're actually using pressure on acupoints, the least effective mode of stimulation, but something owners can do at home on a few select points. We'll instruct them sometimes for that as well.
Would that be like a massage kind of?
Yeah, massage indirectly, you're gonna hit a lot of acupoints, but specifically, I think we talked about this with Mia on her hind feet. There's a point kind of at the base of the paw pad that helps with that proprioception in their hind feet. So that's a common one I recommend for owners as well.
So kind of recapping that. So there's a bunch of different kinds. So you've got regular needles, electro needles, hydro needles, putting air under the skin, I think. Laser acupuncture, and then acupressure, basically.
Yes.
Those are kind of like the main
And
ones.
hemo acupuncture, where we'll
Hemo?
inject their blood sometimes.
Yeah, I was thinking when it said hemo, I figured that's what that meant. Okay.
Yeah. So there's so many forms. We usually do the direct needling with the needles. Then we do
Electro
some
and
electro, and then the acupuncture as well.
Because your laser thing that you do, and I think I have a question about this on here somewhere, but are you doing laser acupuncture, or is that a different kind of laser?
So essentially, generally speaking, we are just
You're using a red
specifically.
laser.
Yeah, so it's a red light laser. So it's red and infrared light that's basically helping with cellular energy, helping heal the cells internally
Right.
from the mitochondria. So helps to just relieve pain, inflammation, and cellular regeneration, essentially. So what we did on Mia and what I do on most patients, I have like a laser point, like a actual accessory that focuses directly on the point, but a lot of times I'm just lasering over regions that I think might be irritated or inflamed. So,
Gotcha.
but you can directly laser over an acupoint with a specific aperture.
Interesting. Okay.
Yeah.
Feel free to jump in. Anytime, by the way.
I am just fascinated.
Okay.
'cause-
I was about to say, I'm just hogging the conversation,
Well,
so feel free to
you-
jump in whenever you want to.
Absolutely, but no, I'm just fascinated because I would never have thought until knowing about Mia that you do acupuncture on dogs.
Yeah.
I've only ever heard of it for humans.
Yeah.
And that's so common to
Yeah.
hear. People are always very surprised when I meet a stranger
Yeah.
and they ask what I do for a living. Most of the time it is, I had no idea that was an option. So
Yeah.
so it's great to spread awareness. I'm thankful to be able to do that. Yeah.
Absolutely.
Well, go ahead.
I was just going to say, because like Mabel, when she got older and had the arthritis, the only thing I'd heard of doing was giving her supplements,
Right.
painkillers and supplements.
And then there's that new drug too, and was it you that said?
Oh,
you did more?
Librela.
Yeah, was it you that said it was like, don't do that? 'Cause
I am not.
I
I
think
mean,
you told me also
in
because Mia didn't have it.
just because Mia had some deficits, some proprioception deficits in her hind end, the spinal component, I personally am a little weary of using that when they have potential spinal involvement with their condition. So there's different approaches to Librela. I'm not saying I'm right and someone else is wrong, but Librela does have an indication in certain patients, but I do feel there are a lot of alternatives, like herbal therapies, acupuncture, laser therapy,
That would also
and
make
so
sense
on.
because you're more holistic.
Yeah, so of
versus-
course I'm steering more
Yeah.
towards, I believe in Western medicine, we integrate that into our practice a lot, but if we can find a more natural approach without the side effects, I'm eager to try that first if the client is amenable to that. And some people don't have the time for it, and that's fine, and then we'll kick over to another option, but a lot of people are really looking for that natural option.
Yeah, well, I'm on Team Melanie, so
you.
okay. Well, I guess you might have answered this earlier, and I guess I'll kind of ask the question, then kind of repeat back what you had said. But what kind of dogs benefit the most from what you do? And you had kind of already mentioned, like when I'd asked earlier, like what's your main patient? You said arthritis, cancer, kind of just old age overall, things like that. But what dogs benefit most from what you do?
So I really like neurologic cases, is one of my favorite ones to treat because a lot of them, especially if it's an acute injury and we get our hands on them pretty quickly, there can be a dog that's paralyzed. Their vet thought there was no other option. Or maybe the vet said your dog needs surgery, but we can't afford surgery or we're just not going down that path. So there's a lot of cases that I get where the vet said this dog really needs surgery or he'll never walk again, and we make them walk. And very commonly we
That's
can
gotta
do
be
that.
so rewarding.
It's so rewarding, and that's why I love those cases. Now, there are some that do need surgery, absolutely, but there's a lot of them. I think there's a misconception, and with my training as well, where you're kind of like, okay, we give them the medicine or we do surgery, but there was no in between. And I have been surprised when I first started by my results that, gosh, this works so well for neurologic disease. So that's probably my favorite.
Yeah.
Arthritis, it is going to be more of a maintenance thing. Those changes are there. Those bones, we are not going to remodel those bones with acupuncture, but we can decrease the pain and inflammation, release endorphins, serotonin, mesenchymal stem cells, and we can really help that pet. But if it's a 12-year-old dog with horrible arthritis, it is going to be a maintenance thing, ideally, where we're seeing them. And some are much less frequent with their maintenance, and we still get benefits. Some come quarterly, and that's all they can do, but we're still seeing benefits,
Right.
especially if we add in some herbals and supplements, too.
Yeah. Well, I guess following up on that, do you do you see any like younger dogs? I know with horses, you're more on like the horses that do shows and sports and stuff like that.
Yeah, a
But
lot
when
of
it comes to
performance.
dogs, do you just get oldies, or do you get like some
Yeah.
young dogs that are like trying to do like preventative care, or
Yeah.
just keep them in great shape kind of care or whatever?
Good question. So we get everything. I would say more old than young, but we certainly get those younger dogs. We get behavior cases. Sometimes our herbal, like those dogs maybe that go to training and it's like, gosh, we're just struggling. This dog has so much energy. Maybe the owner can't exercise the dog as much as they want. So training is we recommend you in training all the time, because a lot of times the dog needs exercise. It needs discipline. You need training to learn how to work with your dog.
Right, yeah.
So that is a huge component with behavior. I'm almost always recommending training. But some dogs have aggression or other issues that with training we haven't totally been able to work out despite the trainer's ability and everything going right. It's just some issues still persist. So the acupuncture can balance some of that aggression.
Wow.
Some dogs are not going to be good. I mean, if they're just horribly aggressive, just like for you probably come across that are just difficult candidates.
Well, we literally don't train dogs that bite people or dogs.
Yeah.
It's just not our thing. It's
So
like
we work with some, but some we're going to say it's not a good candidate for
cane
this.
corso, aggressive, can't get a muzzle on it. You're like,
Yeah,
I'm not doing it.
there's some limitations for
I'm
sure.
just not doing it.
But we get performance we get field trial dogs.
And those just like to keep the motor high RPMs, where they're just moving and grooving. kind of
Yeah,
thing.
I mean they're very expensive dogs. They're performing, and when we get show dogs, we get like the cattle dogs I was telling you
Yeah.
about. Some cattle farmers that have really high performing, high quality dogs. They get kicked by cows a lot, so we get that kind of younger patient population. Anxiety, big one. We do a lot with anxiety and can get good
Acupuncture can
results
help
with that.
anxiety.
Yeah, absolutely. So we get a lot of younger dogs with anxiety
Really?
as well. And so, there's a lot and some people just want us to be their regular vet. We're not full service, but we can do a lot. So we'll see their dogs, regularly for preventive care and offer as much as we can. And then they have a backup plan. So we do a lot of just general things as well.
Well, I guess you help a lot more people than I would have realized, because honestly, and I might have asked you that before and just forgot, but I really just thought it was like old dogs like my dog was.
Yeah,
So,
no,
it's not
there's a
though. You do a lot
variety.
of stuff
Absolutely.
outside of just that. Are the needles that you guys use for dogs the same as you would use for a human or different?
They are. Now, I get most of mine from a specific veterinary distributor just because I order my herbs from them, and it's just a simplicity thing. And I like their needles. But there are certain needles sometimes that I prefer that are human grade needles, and but they are essentially the same. It's just the manufacturer. Some are veterinary specific, but they're very much interchangeable. Just the size and gauge is essentially what we're looking at.
That'd be like length and then how big the needle actually is and stuff
Exactly.
like that.
So
Well, they were always pretty
indications.
tiny. I mean, with Mia, they
Yeah.
were always like, super tiny.
A horse may
needles.
get a 3-inch, much heavier gauge needle, but for Mia, we did
thank you.
1/2 to 1 inch and a smaller gauge.
My follow-up was, does it hurt?
yeah.
Does it hurt
That's
the dog?
We get asked that all the time. So a lot of times, no. I mean, and in just my personal experience getting acupuncture myself, sometimes she puts a needle in, I don't even feel it go in. I just know, like maybe she pinches my shoulder, so I know she's there,
Right.
but I don't feel the needle. Now, when she places them in my SI region where I have a lot of back issues, the needles in that region do tend to hurt a little bit, not bad, but I feel those a little bit more, and it's not terrible, but it's just because there's so much inflammation and myofascial pain and things like that going on in that region. So those are a little more sensitive for me. But as soon as that needle goes in, it feels good. You get a release, you get the endorphins, you're relaxed, and actually it feels good being in there. So most dogs are very compliant. There are some points lower down on the feet that are going to be, your hands have more nerve endings. So those are a little more sensitive. So some patients don't like those. Some do. We did those on Mia. Those
are the
are
only
really
ones that she
strong,
would ever,
powerful.
raise her
points.
her teeth at you.
Yeah.
Because I was gonna say firsthand experience, like my dog, like whenever you were popping needles in her, like she was totally fine with it. The
Yeah.
only time she ever really had issues was like the one that was like right on the knuckle, really.
Yeah,
like
she
those
didn't
ones,
love that.
Yeah, and I mean she fortunately, she never like snapped or anything. She would just kind of raise her teeth a little bit, or show her teeth a little bit. But other than that, like
we always listen to the patient too. Like if this is going to be perceived as super negative, like if they're just a little, I don't love it, but they're compliant, they're still happy to see us. We may go for it because some of those points on the feet are really, really powerful. And I really want this to, we're doing everything,
Right.
so it's pros and cons of each, but some dogs don't need those points. A lot of dogs don't care. So we just kind of look at their response and determine, okay, there's over 360 points on these dogs. We have more to choose from. So we don't always have to choose a specific one that we initially set out to do. Yeah.
Yeah, that makes sense. Yeah, I would say too, I mean, it's kind of interesting because once again, firsthand experience, like you would think like the dog would be very averse to it, because like Mia absolutely hated the vet's office, but like got so excited when we pulled up to y'all's property every time, because like your property is on your farm, and so, every time we turn in the driveway, she'd start going, brr, barking and getting excited and stuff. And then whenever she got in there, she was happy to see you, happy to see your colleague. She'd like almost try to jump on the table, she was just so happy to be there, and so it was really interesting because you would think she would be very averse to it and like not like it because she's getting stuck with 30, 50 needles, however many it was. And it's like, no, she actually really liked it quite a bit,
Yeah.
So,
and most do. I mean, really, I will say, and some at the first visit, they don't trust it. They don't know what's going on. But almost every single patient we see gets better with every treatment. And we hear that all the time. They get excited. They know they're coming. I mean, one thing, Megan is amazing and she makes homemade treats, that we offer. I feel like Mia, we didn't really give her, you just kind of held her.
She actually want treats.
She didn't really want treats. She just wanted your love. And so some dogs are like that and that's fine. But some come for the food, in their mind. And it's just, relax. You kind of feel like you're coming to someone's house. We have regular furniture. We just try to keep it like, hey, you're coming over to the house. We're going to love on you and it's going to be a good experience.
Yeah, it is really nice. What else was I going to say? Oh, she did hate going to Dr. Parker's office basically until the day she died. She really did hate that. I think it was because it was a regular vet though. And like whenever Dr. Parker would walk in the room, she'd walk up to him and be like, hello, and then walk back to me. But it was a regular vet in the sense that it like had all the smells and the noises and the stuff you were talking about earlier in the show where it's like, oh.
Well, there's a lot of things happening in a regular vet clinic. I mean, there's dogs unfortunately dying. There's dogs in distress. And I mean, as you know, their noses are very strong. I mean, they can smell and sense that. So I think that's why a lot of them get that anxiety.
So bad.
Yeah.
It's so bad.
And some don't. Every dog's different, but some do get that vet clinic anxiety, that white coat syndrome.
Yeah. Oh, that's a good name for it.
Yeah.
White coat
That's good.
syndrome.
Yes.
Okay. Well, we've already talked about that. I was going to ask what kinds of conditions does it help, but we've kind of already talked about that.
Can I ask a question?
Sure.
So, I don't know whether it's because I've only ever watched acupuncture as like a drama type thing. But when you tap the needle in, I've seen it where they like twiddle the needle. Is that
Good
about
question.
placement or?
So really it's about stimulation.
Okay.
So it's more of a human, what I learned in my training is tapping and twisting is more and I feel my acupuncturists do it on me. Twisting one way can do one thing, twisting another way can do another thing, but it's more of a human thing. They actually haven't found the same benefits to tapping and twisting in veterinary patients.
Okay.
Now, sometimes you may think I'm tapping the needle, but really it may be backing out a little bit and then I'm just putting it back in. But really, regardless, even in human acupuncture, by like stimulating it with electro is going to be your strongest form of stimulation, but that does pertain more to human acupuncture. But that's a
Gotcha.
great question. Yeah.
I didn't know whether it was for like dramatic effect.
No, it's actually,
where they go like twiddle and they go, oh yeah.
Yeah, it's actually a thing. Yeah, it helps get a stronger response. Yeah.
Wow.
Where are you watching acupuncture at? On YouTube?
I know. I'm wondering.
I don't know.
She said she's watched it like a drama.
It might have been like a
soap
medical
opera.
drama or something, but
She watches all these crazy like pimple popper videos and stuff. So I'm like, are you watching acupuncture videos
Yeah,
later
we're
down
gonna
on
be-
but
YouTube?
now I'm going to.
I know.
Now I'm
she's-
going to check it out. But I saw
Turn
it where
off
they, because it was just like a simple pop and it's in, but then they went back and went, see?
It's crazy too because you're kind of quick with it too. Like you'll just be like, we'll be there, and the next thing you know, you've got needles sticking all out of
Yeah,
your
and
dog. And you're
that's
like,
different for dogs versus humans too. Sometimes you've got to just roll with it.
Yeah,
You know?
I mean, they're just popping them in, and Megan's helping out and stuff. So,
Yeah.
anyways,
Well, when you know what you're doing.
yeah,
Yeah.
I mean, no, do it if you do it all day, every day.
Exactly.
What's something that people get totally wrong about acupuncture, like, or just maybe misconceptions? Because maybe not even wrong, but maybe just like misconceptions people have.
I guess one thing that comes to mind is, probably from a veterinary standpoint, I get this a lot when I talk to other veterinarians and I say, that patient would be really a good candidate for this. And so many of my colleagues around Memphis, they say, really? Acupuncture for that? I thought it was only for, intervertebral disc disease, like the back dogs with the back problems, the paralysis. I thought it was really only for that, maybe a little arthritis. I had no idea that you could help with anxiety, behavior, oncologic cases, even some internal medicine cases, helping to mediate some of those clinical signs and so on. So I think that is a big misconception amongst veterinarians that I probably need to do a better job of spreading awareness in the community, but also amongst owners, or just like Sally said, like, you do acupuncture on animals? Like, I thought that was only for people kind of thing. So that's really common as well.
Well, hopefully putting this out, more people will know about it. And
Yeah,
then
I hope
once we're done
so.
too, we'll send you
Well,
a bunch
especially
of.
for anxiety. How many people contact us saying, my dog is anxious?
Yes, and working with a trainer, that's where I really like that community of trainer along with the acupuncture, because we can both. A lot of times I say this dog's not getting enough exercise, but I can only assess that patient on the training level so much. So I like to team up with a trainer on something like that, because some of it is going to be their environment and their training.
I'm thinking, should we put together an anxiety package where it's
Yeah.
like we do training / acupuncture
Absolutely.
mix?
Then we
Yeah.
might not have to have so many dogs that are on drugs.
We don't.
We
like
get a
that.
lot off of drugs. We have
we're
a
not
lot,
a big
and
fan.
I will put them on drugs if they don't have the time or the budget for acupuncture and the herbals and so on. Some people want a quick fix. Some people need a quick fix. I've been there, even me trying to be more natural. Sometimes I'm so busy, I don't have time to get the acupuncture as much as I want. I'm going to take the ibuprofen.
Yeah.
Do I want to? No, but sometimes we get in those situations, and I understand that. I meet people where they are, but people do not understand everything that we can do, with the acupuncture and herbals. I had a dog that was on so many drugs, still was anxious. They tried everything. Now the dog's off drugs. We just have them on an herbal that we've tapered down and just do acupuncture maybe quarterly. The dog's great.
Wow.
And they were giving this dog 3 or 4 drugs for its anxiety.
Yeah.
It was awful. She came in crying every appointment, just upset. I mean, it was wrecking her life, and she loved this dog, but she wasn't sleeping. It happened at night. It was awful.
It does sound terrible.
Yeah.
I mean, that kind of just brings up like a larger like conversation though, of like, okay, like, and I don't know. It sucks, but it kind of just how it is with like human and dog medicine. It's like, okay, like let's not fix a problem, because then we can just sell you pills forever, and it's like, oh, that's a little dirty, where
Yeah.
it's like, and I'm not saying that vets are trying to get rich off of pills, but like if they can sell you a prescription or 2 or 3 or whatever it is for your dog per day, and it's like, well, I could just give him like a herbal supplement and get him or her acupuncture a couple times a month or once every couple months. It's like, and we actually get like an actual fix. It's like, that seems a lot better. But
can
also
be
it's less
cheaper in the
profitable.
long run.
I was about to say it's
Yeah.
less profitable, but it's like better.
Yeah,
you
and
know?
that's what I've always, in general, I've always just said, if you do the right thing, then God's going to bless you. You're going to do okay. Just always do the right thing. Don't try to oversell this or that. And most vets don't. I mean, but in general, most vets are very ethical. But in general, if you just do the right thing, there are plenty of things that are ethical to recommend for all these patients, so you don't need to, it's not necessary. And so honestly, I feel like, yeah, we do save people money in the long run. Or sometimes, maybe we could have done Prozac and gotten the same result. Maybe this is slightly more expensive, but in the long run, probably cheaper as we taper down, and just better for your dog.
Yeah.
A better alternative. Yeah.
Yeah, because I imagine taking like psychiatric drugs like that over a long enough period of time changes the brain chemistry of the dog.
It
It has
does.
to.
And some need it still. Some need everything. Some are on the drugs, aren't right. I mean, sometimes we got to do everything. So
Yeah.
we are very open-minded. We do Eastern and Western, but try to be as natural as possible.
That's actually one of the questions I have a little bit later is kind of blending the two or
Yeah.
whatnot. Do you ever find that like, I mean, clearly my dog needed multiple sessions, but
Yes.
do you find that there's every dog that you work with needs multiple, or are there ever like a one and done case, or like where it's just like one session of acupuncture? Like, how does that work?
Yeah, good question. So sometimes it does take a couple of sessions for a patient to even get a response. Usually we're getting a response oftentimes in the first session. That's pretty common. It may be a short response. It may be subtle, but that's great if we get something in the first treatment. Sometimes we get a phenomenal, astronomical response in the first treatment, and it's night and day. That can happen. Where I'm surprised, like, wow, I wasn't expecting that.
Like making a dog walk.
Yeah, and sometimes with one treatment, I mean, it's like a miracle happened. In some, it's like, why is this dog not responding as well as I thought it was going to? So there is a spectrum. There are certain things we look at. Like Mia was older. She had a chronic condition. Those are less favorable things for prognosis and require more, dedication to treatments, more follow-up, less of a dramatic response. Now, young dog, acute condition, young dog just hurts its back, paralyzed. Like that, in a lot of cases, that's a good, we can get on it and they respond faster, better. So usually it's more than one treatment, but I have probably more in the equine population have had horses that were really out of whack, and we treat them one time and then they go on, they get sold, go on, and then you hear later they've been great ever since.
Wow,
so
that's cool.
Yeah.
Well, you kind of hinted at this already, but the question I'd written down here to ask you was like, can acupuncture replace traditional medicine? And it sounds like it can in a lot of ways. And then the follow-up was like, or does it just support them? And it sounds like you kind of believe in like a bit of a mix of like, well, if we could get rid of the meds, let's just do acupuncture and more natural stuff, or you're willing to kind of blend the two if necessary.
Yeah, I'm very much on the blend, I would say, because if a dog has cancer, chemo is not always indicated in every cancer case, but if it's indicated for that patient, then I fully
What does
support.
indicated mean?
Like just
Like
if it's
needed?
necessary,
Okay.
if it's the best thing for that patient, then I will encourage that owner to go see an oncologist. We have some owners that don't have the budget for it, or they're just vehemently opposed to
How much is
chemotherapy.
chemo for dogs? Ballpark.
I mean, gosh, with inflation, it's hard. Drug prices have
this
gone
economy?
up so much. I mean, just the cost to the veterinarian. So it's hard to say. But I mean, just like a classic lymphoma case, gosh, I hate to say this on the air because I may be way off. But I mean, I would
Like I
say
said,
five
this
to
is a ballpark. This is a
10,000.
ballpark, folks.
For the whole
Cool.
protocol, somewhere in there, I would say.
Golly.
So it's a lot that they're investing, and there's recent studies with acupuncture, and actually an oncologist hit on this with acupuncture and herbals, where you can get, almost similar results in a lot of cases with the acupuncture and herbals for lymphoma cases. We tend to do prednisone with it as well. But there are, and we've seen really good median survival times. So I still am
you're
going to
saying,
encourage
like,
you to do the chemo, though, in
You
those
would.
cases. I would, because I think that's just the best, along with the herbals and the
Wouldn't all the
acupuncture.
chemicals and the herbals like kind of cancel each other out, like
They-
holistic and poison
Different
cancel each other out?
different mechanisms of action. So there's definitely a different mechanism of action there. So they're working differently to achieve the same thing, but the chemo will be stronger. But they complement each other. So,
Yeah.
and then there's some cases where I feel like we can just do the natural stuff instead of the medication and get the same result, or sometimes we'll blend both. So, and some clients are very against Western medicine. Some are very against Eastern. I meet people where they are.
Right.
I give them my honest opinion about how I feel, but if you're way over here or way over there, I can educate you,
Yeah.
but I'm not going to force you to do anything. But I like us to stay, ideally
Yeah.
in the middle. And a lot of people fall in that category.
Yeah. That was one thing I really did appreciate about working with you, all that for the time whenever we were working it. It's like you were very open to like, because particularly like one thing was like we had talked about food one time, and I was like, well, I'm feeding my dog raw food, and like I'm not stopping. You're like, fine, don't stop. It's like, okay, I won't.
Like I can tell you what I think about it, but I'm not going to twist anybody. I just want to, give my opinion, and what's working for you. I mean, it's working for you. So,
Right.
So I try to educate, and everybody's budget and opinion and time is variable. So we have to consider all of that.
Okay, and I know you probably can't use the word cure or whatnot, but a question I did right off to the side here that I want to ask, 'cause I didn't know you did acupuncture for cancer, but like hypothetically, can it cure cancer in dogs?
So generally speaking, not going to cure it. And even like chemotherapy a lot of times in animals is not curing the cancer.
Right.
We go for more with chemo per se. We go for more of a remission or a better longer quality of life, but not a cure. When you go for a cure, like in human medicine, you get so many side effects. So the dog's life is, I mean, if you're already 12 and you have cancer and you get a couple more years, like that's good. That's good news. So probably not a cure, even with some cases a cure with an oncologist and chemo, but in some cases not. Now for us,
What would an oncologist? Sorry,
yeah, go ahead.
I was just gonna say, what would like a doggy oncologist do outside of just do chemo? Like, what do they literally? What other tools do they have in their belt?
So they a lot of times will help. I mean, some people choose to do a lesser protocol where they may just do a steroid. They say,
Like prednisone.
like prednisone. I mean, I will encourage people to say, look, even if you're against chemotherapy, go talk to that oncologist. They'll help you stage this a little better so we understand our prognosis, and they'll, help you get a better understanding about all the options that are out there, and just so you have a good, realistic expectation moving forward. I can give you a pretty good one, but they will give you the best. And so they can offer you lesser options that are not full on chemotherapy. Or some people just go really, I mean, some of these tumor types, the oncologist doesn't even have a perfect answer about median survival time. There's not enough research or papers out there, but they're going to do a better job on some kind of unique tumor as far as preparing the owner than I would. So
Gotcha.
sometimes just
So
that
it sounds
consult's
like-
worth it just to set an expectation.
So it sounds like steroids and chemo basically are like they're kind of like tools in their tool belt.
I mean, this is crass, but we often say in veterinary medicine, nothing should die without steroids. If you come in with a very low budget and, inability to really do much for your pet, but something's really bad, given that we don't.
Steroids influence.
Yeah, we don't think that steroids could be contraindicated in some cases, but a lot of times if it's just like this dog probably has cancer, like, here's some steroid, like let's work within your budget. And a lot of times that'll get you a little more time. So sometimes we do that in some cases.
Interesting.
Yeah.
Like I said, I was just so fascinated because like I really didn't like know about doggy cancer and that you worked with that. This is probably dumb, but do dogs lose their hair with chemo the same way that humans lose their hair with chemo?
No, that's a good question. So uncommonly, some dogs can. The
That'd be
dogs with
crazy.
hair versus fur, like your poodle per se that has hair versus fur, like they don't shed. It's a different type of hair type. So they, in
So you
some
could have, like, a
cases,
naked poodle.
can. But I don't feel like, and again, I'm not doing
Like
a
a
lot of
hairless cat.
chemotherapy, but I feel like I've never seen one. But I do remember learning it could happen. But the dogs with fur, no. They go through chemo, and most of the time they're feeling great, and most are not losing hair.
Really?
But their immune system is compromised. So, I mean, if you shave a spot for a catheter or something like that, it may not want to grow back very well. So we see that too.
Interesting.
Yeah.
I had no clue. That's just fascinating. Well, I mean, I feel like we've kind of already talked about this, but if somebody was going to be like, I guess maybe playing devil's advocate, and somebody was like, Dr. Melanie, is this woo-woo or is this legit? Like, prove it to me. Like, what would you say? I guess, what would you say to like sell it to somebody who is like a non-believer?
Yeah, so I'm really scientific. I mean, everything, just being a veterinarian, I mean, everything is based off of science and
literally.
research. And so with what I recommend, my nutraceuticals, any product, I want it to be backed by science. Some products more than others, but and quality control and testing. But just regarding the acupuncture, I mean, I would say there are so many peer-reviewed, double-blinded studies with large patient populations out there indicating the efficacy of acupuncture, probably more in human medicine than veterinary, but there is a lot in veterinary medicine. So if the science is there, what are we going to argue about?
Right.
So I try to just reference that, explain to them. I briefly explained to you guys how it worked. I don't know if I did the best job because you can go on forever. It's pretty complicated and
Sure.
simple at the same time. But so a lot of people get on board and then they see the results. Most patients will have some sort of favorable response to
Right.
acupuncture, whether it's enough or not. And some don't, there are the outliers, but a lot of times the proof's in the pudding. One of my horse trainers said that.
Have
like
you ever
that
seen
one.
it be negative in any cases with dogs before? I have that somewhere on the list. I don't know. where it
Yeah,
is, but I
that's a
figured
good
I'd skip
question.
ahead.
So as far as contraindications for acupuncture,
And just for the rookies, that means negative side
yes,
effects.
so negative side effects, there really are very few. When we talked about it in training, it was like, well, the dog could eat the needle out. You put it in their foot and their mouth's right here. So,
Yeah.
but there's never been a reported case of a dog ingesting a needle and it being a problem. They pass it easily. But knock
You
on
could
wood, have not
literally,
had that
you
happen.
could literally like do this and it would just bend.
They're so flexible and small. So, I mean, there's never been a report of a problem.
No, I guess I meant
documented.
like you pop a needle in
And-
a dog and then it's like, instead of helping it, it like takes away its leg ability or something. That's
Yeah,
kinda what I'm
no,
talking about.
that's
You haven't seen that before.
I have not. Now, the worst I guess I would see as far as a patient, sometimes if we do like a strong treatment on a patient, and then we may go a little lighter the next time. It's not like it's negative, but maybe they're a little tired or drowsy for the next day after acupuncture, or a little sore. Maybe we should have gone a little lighter, but it's just like a little bit of muscle soreness, and then they go on to be better after that. So.
Right.
I want them to walk out feeling their best every time, but if they do feel a little sore it's happened to me too, which, I'm almost fine with it too, because I feel like I get a stronger response that way too,
Right.
but that's really it. I mean, if there's a tumor right here, I don't want to put a bunch of needles right around a tumor. That's going to stimulate that tumor, and, those
Yeah.
cells are already rapidly dividing. So it's, we're healing, but if we're telling a tumor to heal, that means it's stimulating it. So that would be a contraindication. But as long as you know what you're doing,
Right.
Anatomy is super important. You don't want to puncture a lung or, a kidney or something like that. But as long as
That
you're
makes
well
sense.
trained, horses, a needle can break in them because they are so strong with those muscles. Very uncommon. But a lot of times they leave it in there. It's but you do implants actually for, and it's not an issue in dogs. They're not.
If
as
I was,
well
I'm just saying, if I
muscled,
was doing horsey acupuncture and I did it and like half my needle snapped, and then I've got to go tell them, hey, your $multi-$100,000 horse
Yeah.
has the needle stuck
It
off
happened
of
to me once, and I was able to get it out. But as our Dr. Shea at the university says, he's like, "Oh, you're welcome. There's your implant," because they do acupuncture implants all the time. So it's not like it's a
not the end of the
terrible
world.
thing.
It's not gonna be
It could
detrimental.
migrate. I mean, very unlikely to be detrimental. It could migrate. Some people choose to surgically remove it, but I mean, it is very uncommon. So I mean, there's really not a lot of negatives to what we do.
Okay.
Yeah.
Like I said, I didn't know if there
That's
were
a good question.
any risk to it
I asked it
associated.
when I trained, for sure.
Well, I guess overall, so tell me about some of the other stuff that you do / like believe in or whatnot that maybe isn't like super common. Like we mentioned the red light therapy or whatnot. We mentioned I think you said you're in chiropractic school. You're not like a chiropractor yet, but you're on the path, right? And then you do the herbal stuff too. So I know
Yeah.
that's a lot, but like tell us about that too.
Yeah, so the herbs are, and that's something that a lot of, some
Mia did take herbs for the record. She did.
Yeah, and the herbs are, sometimes we get a very strong response to the herbs. Sometimes it's not. Sometimes we have to switch it up and so on. So it's not always one size fits all. It's not like, oh, your dog is having issues walking, this is the herb. It's not always like that. We're looking at a lot of things with that patient to determine the best herb for them and to balance their body. So that's a big thing. Nutraceuticals just are run-of-the-mill nutraceuticals that general practitioners are going to carry, but maybe aren't understanding some of them. The
Nutraceuticals is just supplements, right?
yeah,
for
just
the record.
supplements, which this is a misconception. Owners will go online and they'll say, oh, well, this is the same. It's glucosamine and chondroitin. Well, Nutramax, the company that I purchase most of my nutraceuticals from, they've done studies and compared it to, taken products off Amazon and tested them. They don't actually have what they say they
There's
have in
huge
them.
quality control issues with supplements.
Major quality. There's no regulation by the FDA, so you could just throw anything out there with whatever label, and most of them are safe, but they are not tested for safety and efficacy. So I purchase mine through companies that do extensive research with, veterinarians and so on, and pharmacists to make sure that what we're recommending actually is effective. But there's a lot, I've just focused more on that. I know a lot more about nutraceuticals than I did in general practice. I always recommended them, but with this journey, I've learned more. And there's a lot we can do with that. We do vaccine titers. So if a dog, with vaccines, there's lots of different opinions on those. But, if it's vaccine that we can titer, check the antibodies in the body and not introduce another vaccine booster just because they're due, that's a great option. A little more cost than just vaccinating again. So some people just choose to do the vaccines, but that's something that a lot of people are interested in. Lab work, we offer lab
Real
work.
quick, so we get vaccine paperwork for all the dogs that come to the shop, and they're all in the next room right now. But so if like they have the titer, would you be like not due until X like on their vaccine paperwork, or how does that work?
Yeah, so we would give if their titer's high enough, we would just check it again when their vaccine's due again. Now we can't do that for rabies. They're technically
Legally have to get it. Yeah.
there's technically a titer out there for rabies, but I don't even offer it because it's pointless because legally it doesn't matter what your titer, which I hate that, but I mean legally it does not matter what your
every 3
titer
years,
reads.
right?
Yeah, or if the rabies vaccine is labeled for 1 year, which some clinics carry 1 year, then it's every year they have to have it. Most clinics are doing every 3, which is what I prefer.
Dude, I remember one time I went to this house in Nashville to do an appointment, and this puppy had just gotten back from the vet with all of its shots, and it was literally just laying there. And if you touched it or picked it up, it would start like screeching because it was in so much pain. And I didn't learn until that day, and you told me that this is the law; they have to do it this way. But like literally, the rabies shot is the same size for a Chihuahua puppy as it is for a Great Dane.
It
puppy.
is.
And it's like that's kind of crazy.
And that
Yeah, it
raises
is.
a lot of questions, like a lot of, and I completely the vaccine argument is a tough one because especially after COVID, whatever anybody's opinion is on, I think there's certain indications and there's certain, contraindications for that vaccine. And I understand the variety of opinions and respect all of them. But I feel like that raised a lot of concerns and had us start questioning things because there was a lot of ambiguity. Thank you. There's a lot of ambiguity with that vaccine. There was a lot. It was new. There's a lot of things that are changing, and people lost trust, and then it trickled down into the veterinary world. Now, our vaccines have not changed that much in the veterinary world, so that's good. But it's
You
hard
also
to know.
didn't get a new one and say that every dog in the world had to take it.
Yes, there is that too. So I understand. I think we should question it. Now, do we have all the right answers? No. Are these vaccines tested at the same dose? So that's the dose that we use on every size dog? Yes. But is that a question we should ask? Sure. I mean, I think
Just saying, it's kind of crazy.
yeah.
A Great Dane puppy and a Chihuahua puppy are very different size puppies.
I agree. So I think there's a lot of things that need to be explored in that field, and that we, the research is not there, unfortunately. Yeah. So it's a struggle, and there's no right answer for a lot of these things. Yeah.
I'll say for me, my distrust of the vet, generally speaking, and why I did start trying to take a more holistic route with you and Dr. Parker was because of the Previcox. Honestly, like the vet that I was taking Mia to most of her life, the latter half of her life, like the last, like probably say like after 5 years old or whatnot, I was taking her to a local vet, very big, very successful or whatnot. And I didn't realize this until afterwards, but they had prescribed me Previcox or whatnot. And I'll be honest, if a doctor prescribed me a medicine, I would look into it. I'd be like, what are the side effects? What does it do?
Sure.
And I'd probably just not take it, honestly, if I'm just being completely honest. But with the vet, I just didn't even think to ask questions like, hey, what does this do? What are the side effects or whatnot? And so before we had tried you and Dr. Parker, I'd given her this Previcox, and she literally got so much worse. It messed with her brain in some way. She's throwing up. She's not eating her food. She's walking worse all of a sudden. And it was literally just like a weekend, And I was like, oh my God, like my dog is going downhill drastically. And I don't know, it really scared me a lot. And so then after that, then I looked it up, like the side effects of Previcox. And I was like, oh my God, I didn't even know about
And
this.
I would say that's very uncommon to see a dog react that way. But again, you look up the side effects of a drug, and the list is this long because if one dog in that clinical trial exhibited that side effect, then it goes on the label whether the risk is very low or really high. But yeah, there's outliers. There's going to be dogs that have vaccine reactions, have drug reactions, and so on. So that risk is there, and we need Western medicine with all the risks involved. We need vaccines and so on. But I do think there needs to be more research, like protocols for vaccines need to be perfected. We have to go off of what we have for now. But as far as the drugs, there are alternatives, but most general practitioners just aren't trained in that, And so it's just kind of, so there's in general practice, I would prescribe the Previcox in a lot of cases, but they're not set up or trained to offer the integrative approach. So great that we have everything to offer our pets, but in some cases, some people want to steer more integratively. So
well, I know I'll be doing that for the rest of my life and my dog's lives. But it was just weird because after I died, I moved. After Mia died, I moved, and so when I was packing up all of her stuff, like we had a whole medicine cabinet and is basically half full pill bottles of, because I'd do like half of it and then I'd forget to give her the other half of the prescription basically. And literally it was like, no joke, I'm not even exaggerating, over the course of the years, probably 10 or 15 bottles of Previcox. And it's like, it was just like, I don't know. It's like, are they Previcox mills? Like it just, I don't know. Just feels dirty and weird.
Yeah, I mean, I think with
it just feels
her,
weird.
all of her is the anti-inflammatory going to help her and so on. In a lot of cases, we will reach for the Previcox or the anti-inflammatory or steroid for a dog like her. But in her case, like, I just think a lot of people don't know about acupuncture, and that in her case is going to help her better. But it's just, I mean, when I was a general practitioner, I didn't know either that there was an alternative, honestly. So it's about getting awareness out there, I'd say.
Spread the message. Spread the message.
Some alternatives, and sometimes we need the Previcox, but there are some cases that, can benefit from other things, certainly. So
yeah. Well, I have a few more. Did you have something?
I was just going to ask you, what improvement did you see in Mia from her time having acupuncture?
Yeah. Well, I mean, candidly, I'd say it's like tough to put it as like just acupuncture because we were doing a lot of stuff like all at the same time.
Yes,
like
she was getting everything.
She was acupuncture, chiropractic, raw food, exercise. Like so, and I did want to ask too about like what role diet and exercise plays. But overall, I would say the biggest thing for us was it really just like slowed the progression of the disease down or whatnot. Because like, and this is something, I don't know if it was you or Dr. Parker who told me, but somebody had said like, you don't really like know like how much faster she would have gone downhill had you not been doing all those things. Because it might have been that maybe I had like a bad attitude about it. So I was like, well, I did all this stuff and spent all this money and then like overall it didn't work. Like the dog still died. But I think it was you who told me this, and you were like, well, like you don't know like how much better of a quality of life that gave her or whatnot. It might have been.
Yeah, it was me because I feel like cases like Mia are hard. And I have another dog. I think I told you about the other dog that looks like Mia, similar issue and everything. And it's hard, you grow, I get attached to these dogs too, and the owners, we develop this relationship, and it's hard to watch them progress in their disease process. But some disease processes, I don't care what you do, Western, Eastern medicine, whatever, or a combination of both, they will decline. But it's about slowing that progression. So some cases, it's like, okay, the dog will continue to get worse despite what we're doing. But, after the acupuncture, maybe they feel, you see them perk up a little bit, or just knowing what her median survival time was and knowing, hey, we got a lot of good quality time out of this dog.
We really did.
Yeah.
And I will say
so those are the ways to look at it.
Yeah.
Which is hard sometimes. Yeah.
It is, especially whenever you're investing a lot like financially into your dog doing well or whatnot. But I will say one thing you were asking, like, what did we see a difference in or whatnot? And I will say, because I texted you this a bunch too, but like the day after, there was like a much more of a pep in her step or whatnot. Because I told you, I basically I altered like my complete life plan around the dog. We would go walking, we used to go walk the green line every day. Now we're hiking at Shelby Farms every day because she can walk on dirt and grass the whole time, and like we'd go on a 45-minute walk, but now we're going 12 minutes in and 12 minutes out.
And then your wagon, remember your wagon.
I still have the wagon in the back of my truck. But yeah, and so anyways, but she had much more pep in her step the day after or whatnot. And the subsequent few days or whatever till we'd like come in the next week or the week after, whatever it was. So overall, just like more pep in her step. I think like just gave her a better quality of life. Like the 6 months that she was around post starting a more holistic approach to medicine and stuff like that.
Yeah.
So anyways, it was great. It was great. I did want to ask your opinion as a vet. What role do you think that diet and exercise, lifestyle, all that kind of play into their overall like health or healing if they have something going on with them, things like that?
Yeah, that's a great question, because I think also like integrative medicine, we as a community, as a whole, especially in the South, we neglect diet and exercise. And
the South?
Not us. Even I do myself, I get busy, and then I'm working in rural Tennessee, and there's only a gas station within so many miles, and I'm eating out of the hot box at the gas. I mean, that is not good for me, but I need food. So, sometimes we make poor choices in diet. But diet and exercise, as I think most people know, really can influence your health. It gets complicated with dogs because when we home cook food, in a lot of cases, it doesn't have enough taurine in it, which is really important for cardiac health. If they don't have enough taurine, they get dilated cardiomyopathy, which leads to a big floppy heart that doesn't beat properly or contract properly, which leads to heart failure. So since home cooking is good, but since people have started home cooking, they're taurine deficient diets, or maybe they have too many lentils. There's some other things. And actually there's a lot of things we don't know. There's certain diets that have enough taurine, but we're seeing DCM in those dogs now. So there's a lot.
What's DCM?
The dilated cardiomyopathy. So
Gotcha.
now like Tufts University is doing a study. There's a lot of institutions that are doing studies. We don't have all the answers, but there is an issue with certain diets, and we don't have all the answers. Now, if you home cook, which is best, the gold standard is to get a consult from a board certified nutritionist to help make sure your diet's balanced. That's very expensive. So a lot of people, understandably don't choose that option. We don't even have one in our region. Nashville is the closest.
For a board certified nutritionist? Sounds like
We
you
didn't
need to
even
go get
have
it.
one at Mississippi
I was
State.
about to say, sounds like you need to get another certification.
I know. But yeah, I mean, it's really, and we didn't even learn from a nutritionist at Mississippi State. So our education, and some schools have them, some don't, but our education as vets is very lacking in nutrition. So commercial dog food. But we've now found that highly
That's kinda
processed
crazy.
commercial high carb food is not best, but a lot of people are going to feed it due to price, convenience. And is it bad? No. But is there better? Yes.
Yeah.
But you have to be careful with your better option because it could be worse due to the risk of DCM. So you have to be careful with how you do it. There's food toppers that high quality companies make with a lot of research with board certified nutritionists on their team where you can add certain things to the diet. They help you with recipes. Chi Dog is one of those. They can help you with recipes, or they have their own food. But it's just something we could talk about it a long time. But you have to be careful. Fresh whole ingredients are great, but you have to be careful. So I will have an in-depth conversation with my clients about this if they're interested in trying to do better. Or maybe we do the kibble and 25% of the diet is natural stuff that we
Yeah.
add to it. Better than just kibble.
Yeah.
Or maybe we just do a high quality kibble, but we can do better. And
Yeah.
exercise is so important for the musculature. We have joint problems. Mia, she was atrophy from her neurologic condition. She had muscle atrophy from disuse and probably from a neurogenic atrophy. So working to strengthen.
wasn't from lack of
No.
hard work and effort.
No, it was not from that because Corey worked extremely hard with
I
this
just meant
dog.
no. She did. She was
And
like an
she-
athlete
yeah.
her whole life, like even up until the day she died. I mean, literally, like right before Dr. Sally put the shot in her, she was biting on the puppy sleeve. Like getting her
Yeah.
last bite. And she was an athlete, like
She
till the day she
was.
died.
And you stayed so involved. You kept her going. You interacted with her, put the time into it. Took her on the 4-wheeler, all the things.
Yeah. Oh yeah. Well, real quick, I want to be respectful of your time. If we have to wrap it forward, then it's about 4 o'clock
Sure.
right now. But if you've got time for a few more questions, I got a few
yeah,
more things I'd
that's
love to
fine.
ask. Well, I wanted to ask. Also, I guess, what's one of your favorite like success stories that you've had?
Gosh,
Like
that's
any dog
tough.
specific. I know you've talked about like bringing dogs back that like couldn't walk and now
Yeah.
they're walking, but I just didn't know.
Oh,
if, like, any.
let me think. There's a unique one that I could bring up. I mean, maybe not but this is a good success story. Some have been more miracles than this, but there's this dog that came in that had damage to the muscle on the head, this like top muscle right here, the temporalis muscle. The dog jumped out of the truck, hit its head, and then the muscle was just gone.
What do you mean gone?
Just it atrophied. It just went away.
Oh,
There was a
God.
nerve damage. Essentially, a nerve was damaged to that region,
Ugh.
and the muscle just had atrophied from that injury. So essentially, this owner had been to the regular vet. They tried multiple things. They did a great job working up this case, but it was just nothing. Nothing was helping. And it wasn't just cosmetic. I mean, that can affect their chewing and so on. So anyway, we ended up doing acupuncture and actually got that muscle, that got the nerve function to come back, which then in turn built that muscle back. I think there's a picture of that on my Instagram. Now, I didn't fully finish treating this. We made a lot of progress, and then she moved out west, so we didn't fully finish
Sounds like they have
the
a lot
treatment.
of them out there, though.
Oh
so.
yeah, she was fine, and the dog did great, but nothing worked. And then we
That's
did this,
crazy.
and
Yeah.
now we have full musculature. So really cool.
So when you say it atrophied, so like, I guess like that little like you're talking about like the little thing you can kind of press on the top of the dog's skull or whatnot, and you mean
Yeah.
like there was like a little dip there, like
So,
it had just like
yep,
if
one
my
side was
bicep
normal.
if it atrophied, it would be like a small little arm.
Yep, just like Mia's legs were kind of smaller behind than they used to be. She used to be better muscled. Then at the end she lost muscle. So yeah, this was just a direct nerve damage. And we were in every case may not be like that. We did pneumo acupuncture on that one where we put air, and actually the pressure from the air helps stimulate the muscle to come back too. So it's a neat case.
That sounds, that's fascinating.
Yeah.
That's fascinating. Any other favorites you want to share that you think of?
I'm just
really
trying to
cool.
think of, I did talk about that one client that came in with that anxiety, that dog with severe anxiety. And it was just, her life was wrecked.
Brilliant, yeah.
And now that dog's doing great on,
you still
no
treat that dog?
medication. I do. Yeah. So she still comes, she drives from Millington. So she drives really far, but she still comes in quarterly and we're doing great. There was a paralyzed dog. Actually, Gravy Train was paralyzed. She came from Missouri all the way to see us, and we
That's
got
gotta be
her.
such an honor that people would be willing to travel that far for you.
Yeah, it
What an
really
honor.
is. And so we helped her a lot, and that owner just loved that dog. Would do anything for her. So those are just really big success stories.
That's
when you
sweet.
can really help somebody.
Okay, I have to ask just because I'm curious. But with like a dog like Gravy Train, where somebody comes into town for that, do they stay multiple days and you're doing like back-to-back days of treatments, or like? Because ours were always spread apart by like week, 2 weeks, and towards the latter half, like a month apart or whatnot. But
So based on that situation, which the dog kind of lived mostly in Missouri, but the owner, it was almost a joint custody situation where the dog kind of went back and forth. But the dog essentially lived in Missouri, but she still really cared about the dog and knew she had an issue. So she wanted to do what she could to help her. So she'd go get her and she'd come to us and get her treatments.
Wow.
And she was, really dedicated to this dog's health. And, the other owner realized, wow, this really is something we can fit. It's a hard situation. It's hard you're going to drive this far and invest this for this dog. But, it was a great success story. So, yeah.
That's so cool. One thing, and this is honestly something I could learn more about too, but like, what are signs that, how can you tell that your dog's in pain that like people might overlook commonly or whatnot?
Yeah, that's a great question because
Panting.
dogs are, panting. They, sometimes just as they stand, like a sit to stand is a little slower, a little harder. Mia did this where when they defecate, they kind of, have to move. They walk sometimes. I think
Walk and pooper?
she was doing that then. So they'll walk and poop because holding a squat is a lot harder than walking in a squatted position. So that's a sign. Not wanting to jump. And maybe we always used to jump up in the truck every time, but now we're just putting our front feet up and standing there. And just lethargy or,
So
just
stuff
not
that's
as
like outside of their
excited.
routine a little bit.
Yeah, and dogs are tougher. They compensate. We spay a dog and they're wanting to run around the next day. You do a hysterectomy on a woman and they're out for months, essentially. So we feel pain differently than them,
Right.
but also they compensate. They're survivors, so we overlook their pain a lot. And just like us, you may not know my back's hurting today, but I walked in fine. I can lift things, but I'm doing well. But that doesn't mean I have an issue that you can't see, but that's there, and they can't tell us that. So that can be really hard too.
Yeah. Yeah. I think that could be something that people like overlook all the time. That like,
All the time.
especially if they're, and as trainers, we run into people who a lot of times, like just don't have the best dog sense, and it's like they love their dog, but they just like are dog clueless, a lot of times in certain
Takes
areas.
years
or
of
whatnot.
experience.
It does, yeah.
Yeah.
And so, anyways, I just wanted to put that out there for people.
Absolutely.
If somebody wanted to hire a doggy acupuncturist or whatnot, is there anything that you would recommend? Like if they didn't live in the Memphis market or something, like if you're in the Memphis, go to her. But if they're not in Memphis and they wanted to look for a doggy acupuncturist, like what would you recommend they look for in a vet that offers this service?
Yeah, so I do this all the time because I have people that vacation or they move and I'm having to try to help them find an acupuncturist. But I really, I'm obviously partial to the way I set up my practice. I set it up the way I wanted, but I do like a practice that strictly focuses on acupuncture or integrative health because that isn't seeing emergencies and stuff like that. Because I feel like for me, I can be more focused on that pet. So I like that structure. I like there are plenty of other acupuncturists that have a small facility that at their home or something like that. And a lot of my clients really like that. I get a lot of compliments on how well the dogs do in those environments. So that's a perk if that's available. Someone that just, is dedicated, really passionate about it, dedicated. because it's hard to do it part-time. There are people that do it part-time and do really well at it, but I think just someone that's really immersed in it and
Keep it up with it. It sounds
pursues their continuing education in integrative care versus other things.
Yeah.
So I think those are important things to look for. Yeah.
Do you think that they need to have like a certification similar to yours, or would you be willing to recommend somebody that doesn't necessarily have like your type of certification?
There's different places to train. I preferred the institution I went through.
I just meant specifically a certification, not necessarily where you went.
Not necessarily, but at least having done the training course, having completed the training course, I think you really have to study. But I mean, I think it's good to have immersed yourself and to continue to do education in integrative care. I think that's going to be a bonus.
Yeah. Okay. And then I guess last one before we like plug your stuff and tell everybody where to find you at and stuff like that is like, if you could leave like dog owners with like one message, like what would you say?
So I would say that's a tough one. I mean, really just ultimately, try to pay attention to your dog, pay attention to the subtle changes, try to support them, be on top of the care, be proactive, not reactive. Don't wait till the problem's really bad to look for solutions. Don't wait, preventive care, not just, we think of preventive care in vet med as dentistry, vaccines, and, like annual prevention and things like that. But really, preventive care is more than that. So trying to assess the whole pet and making sure that we're addressing all their needs, even if they're subtle, and then it saves you money in the end, and you end up with a healthier dog in the end, and the patient's more likely to respond to treatment in that way. Yeah.
Interesting. You heard it here first. I was about to say, pay attention to your dogs. So that's the big one. Pay attention. Okay. Well, I guess overall, I mean, tell people where they can find you. So, and you are here, you go other places. So
yeah. So I do offer ambulatory services. So I will come, drive to someone's house for services if that's what they prefer. But most of our patients are coming into our facility in North Olive Branch. So our back fence line's Collierville. We're a minute from Collierville, 3 minutes from Germantown, and
25 from Cordova.
Yeah, about 25 from Cordova, about 3 minutes from Memphis, Memphis city limits to really close to Byhalia. We're kind of in this triangle. So we're pretty conveniently located to a lot of areas. And so we have a great facility where you can just come in to bring your dog or horse, or we can come to you. And then I travel to the Nashville area monthly to offer services on an ambulatory basis up there.
Do you do dogs there too, or just horses? I know it's mostly horses.
It's mostly horses. That's kind of been the model up there. But then, every horse owner has a dog. So, and I don't like to say no to people. So.
I was about to say, might as well get them while you're there.
Yeah, of course.
Okay. And then if people wanted to find you online, what's your like socials and stuff like that?
Yeah. So my website is HH Acupuncture, like horsehound acupuncture.vet.
We'll put all that in the show notes too.
Oh, thank you. And then the Instagram is at HH AcuVet. And then my Facebook, I'm not internet savvy, but I think if you just type in horse and hound veterinary acupuncture and wellness, it'll pop up. And we have a Google page as well. There's some reviews on there if you need to read those.
Yours truly has left a review.
Oh, yes, we appreciate that.
Well, cool. Well, guys, I can't recommend it enough. Like I said, it was super helpful for Mia during her, last days or whatnot, and just giving her, a good quality of life and stuff like that. So once again, thank you so much. That was just so amazing. And then thank you for coming on too and sharing all this. I definitely learned a lot.
I've
sure.
learned so
yeah. I mean, this was
Good.
a fascinating conversation. And I'm excited to see how it keeps playing out. And hopefully, this can play a small part in just teaching people more about this service. Because, like I said, I just don't think people know.
I don't either. So I really appreciate the opportunity. It was fun and great to see you again. I've missed you and of course Mia. So it's great to just connect again and catch up and have this opportunity. Thank you so
I got
much.
all your cards. Thank you so much. That was super sweet.
Of
I think you
course.
sent like a Christmas card and then a card after Mia. So, anyways, thank you so much. That was very sweet
Happy
too.
Happy to do it.
Well, guys, thank you all so much for tuning in and sticking with us to the end. Like I said, if you learned anything from today's show, and I know you did because I did. So if you learned anything, we just ask you to share this with like a friend, family member, colleague, something like that, just so we can get the message out there. And subscribe to the show if you haven't already.
Hit that like button.
Yes, hit the like button too. So anyways, guys, thank you so much. Remember, you can get your dog trained and that can get you some peace, but the only way to true peace is with Christ Jesus, the Prince of Peace. All right, bye.
Bye.
I like that.